Welcome to Pro Webcast News, where we bring you daily industry updates. Today is Thursday, May 20th, and you're watching the Afternoon Update with Paul Wilson. Today's news is sponsored by American Retirement Systems, providing competitive solutions for agents and advisors. For more information, please visit AmericanRetirementSystems.com. Now for today's headlines. The number of Americans filing new applications for unemployment benefits rose unexpectedly last week, the first such increase since early April, according to the Labor Department. Initial claims for state unemployment benefits rose by 25,000 to a seasonally adjusted 471,000, the highest level since the week ended April 10th. Yet despite the dip, the Philadelphia Federal Reserve Bank's index of mid-Atlantic business activity rose to 21.4 from April's figure of 20.2, providing hope that the economic recovery is slowly continuing to advance. In insurance news, a recent study has found that intensive care patients in Pennsylvania who don't have insurance are 21% more likely to die than those with insurance. The University of Pennsylvania's study of intensive care units in the state supports the idea that a lack of health insurance can often be deadly. The study examined nearly 167,000 patients under the age of 65 between 2005 and 2006 in Pennsylvania ICUs and found that uninsured patients were 21% more likely to die within 30 days than patients with private insurance. Researchers are afraid that in addition to arriving at the hospital in more advanced stages of disease because of a lack of access to doctors, some patients could be treated differently by some doctors and hospitals because they don't have insurance. In other insurance news, 10 million Americans are now covered by health savings accounts, or HSAs, a 25% increase from last year, according to a new census released this week by America's Health Insurance Plans. Since the authorization of HSAs in January 2004, AHIP has continued to conduct periodic census of health plans participating in the market. The most recent census found that between January 2009 and January 2010, the fastest growing market for HSA HDHP products was large group coverage, which increased by 33%, followed by small group coverage, up 22%. Meanwhile, 30% of those covered by an HSA plan were in the small group market, 50% were in the large group market, and the remaining 20% were in the individual market. Finally, states with the highest level of enrollment were California, Ohio, Florida, Texas, Illinois, and Minnesota. I'm Paul Wilson, and thanks for watching Pro Webcast News. For more in-depth news and features, visit producersweb.com.